If you've ever been told your blood pressure is a little high, borderline, or something you should keep an eye on, this video is for you. High blood pressure affects more than 1 billion people worldwide, and many don't even realize they have it, because it often causes no obvious symptoms. In this video, I'm going to walk you through science-backed, practical ways to support healthy blood pressure naturally. Strategies that work alongside medical care, not instead of it. These aren't quick fixes, but habits that support your heart, your circulation, and your long-term health. Before we begin, please remember that this video is for educational purposes only and isn't intended to diagnose, treat, or cure any medical condition. Always consult your healthcare provider before making significant changes to your health routine, especially if you're currently taking medications. Your heart pumps blood through your circulatory system, creating pressure against your blood vessel walls. This pressure naturally rises when your heart contracts and falls when it relaxes. However, when blood pressure stays elevated over time, it can strain the heart and blood vessels and increase the risk of cardiovascular problems. That's why supporting healthy blood pressure early matters. Now, let's begin with some simple science-backed lifestyle strategies that may help support healthy blood pressure. Focus on nutrient-dense whole foods. One of the most well-researched eating patterns for blood pressure support is known as the DASH diet, which stands for Dietary Approaches to Stop Hypertension. This approach emphasizes whole, minimally processed foods like fruits, vegetables, whole grains, lean proteins, nuts, and seeds, while limiting heavily processed foods. Studies suggest that following this eating pattern may help support reductions in blood pressure of around 5 to 6 points in many people. Rather than focusing only on what to remove from your diet, DASH encourages adding foods that naturally provide nutrients like potassium, magnesium, fiber, and antioxidants, all of which support cardiovascular function. Reduce your sodium intake strategically. Many people assume salt from the shaker is the main issue, but research shows that most dietary sodium comes from processed and restaurant foods. Even meals that seem healthy can contain an entire day's worth of sodium. Reading nutrition labels, cooking more meals at home, and choosing fresh foods can make a meaningful difference. Finland provides a powerful real-world example. After introducing public health policies to reduce sodium consumption, the population saw significant drops in average blood pressure and major improvements in heart health outcomes. Increase potassium-rich foods. Potassium plays an important role in balancing sodium in the body and supporting healthy blood vessel function. It also helps the kidneys remove excess sodium. Foods rich in potassium include bananas, oranges, sweet potatoes, beans, avocados, and leafy greens. Research suggests that increasing potassium intake through whole foods may help support blood pressure improvements in some individuals. However, people with kidney disease or those taking certain medications should speak with a healthcare provider before significantly increasing potassium intake. Maintain a healthy body weight. Body weight and blood pressure are closely linked. Research suggests that for many people, losing even a small amount of excess weight may support modest reductions in blood pressure. This doesn't require extreme dieting. Consistent habits like eating whole foods, managing portion sizes, and staying active often support both weight management and cardiovascular health over time. Try regular physical activity, including isometric exercise. Physical activity is one of the most effective lifestyle tools for supporting healthy blood pressure. Recent research suggests that isometric exercises, such as wall sits, planks, or static squats, may be especially effective for some people. These exercises involve holding a position rather than moving through repetitions. That said, the most important factor is consistency. Walking, swimming, cycling, resistance training, and even dancing have all been shown to support cardiovascular health when done regularly. Limit alcohol intake. Alcohol can raise blood pressure, particularly when consumed frequently. If you choose to drink, moderation matters. General guidelines suggest limiting alcohol to no more than 1 drink per day for women and 2 for men, though individual responses vary. Prioritize quality sleep. Sleeping fewer than 6 hours per night has been associated with higher blood pressure risk. Creating a consistent sleep routine, limiting screen use before bed, and sleeping in a cool, dark environment can all help support better sleep quality. If you sleep enough hours but still feel exhausted, or if a partner notices loud snoring or breathing pauses, it may be worth discussing sleep evaluation with a healthcare provider, as sleep apnea is strongly linked to difficult to control blood pressure. Manage stress in practical ways. Stress affects blood pressure both directly and indirectly. While short-term stress raises blood pressure temporarily, chronic stress often leads to habits like poor eating, inactivity, or increased alcohol use. Practices such as deep breathing, mindfulness, physical activity, social connection, and enjoyable hobbies can help reduce stress and support cardiovascular health. Consider pet companionship as a supportive lifestyle factor. Interestingly, research has found that pet owners, particularly dog owners, often have lower blood pressure than non-pet owners. This may be due to several factors including increased daily movement, stress reduction through companionship, improved routines, and greater social interaction. Pets don't directly lower blood pressure, but the lifestyle changes and emotional benefits they encourage may support heart health over time. While this shouldn't be viewed as a treatment strategy, it's a reminder that enjoyable, meaningful activities can positively influence health. Understand your blood pressure numbers. Blood pressure is measured using two numbers, systolic, top number, and diastolic, bottom number. Many health organizations now consider readings below 130/80 as a general target for most adults, though ideal targets vary based on age, medical history, and individual risk factors. You can measure blood pressure at home using an automatic upper arm cuff. Taking readings at the same time each day, while seated and relaxed, provides the most reliable trends. Research shows that lowering elevated blood pressure, even modestly, can significantly reduce the risk of heart attacks and strokes over time. You don't need to implement every strategy at once. Sustainable progress comes from small, consistent changes. Some people may still need medication despite making healthy lifestyle changes, and that's okay. Medications can be highly effective tools, especially when combined with supportive habits. High blood pressure often causes no symptoms, which is why awareness and prevention matter so much. Supporting your cardiovascular health is one of the most impactful investments you can make in your long-term well-being. Which of these strategies feels most realistic for you to start with this week? Share it in the comments, and remember, even small steps can make a meaningful difference over time.